Good evening, this is Face the Nation. It's good to be with you after a lapse of 13 months. Now, as Sri Lanka tries to grapple with the multi-headed hydra that is COVID-19, there are a plethora of health professionals, military sector workers, essential workers and the state machinery working around the clock to curb the rapid spread of this virus. However, amongst the general public, there is a sense of concern for their future. So today we're hoping to find solutions to some of these concerns. We will also be touching on the concept of social responsibility that vests in you and I, as well as the psychological toll that this virus is having on the general public. Now, to do this, we've assembled a panel of experts from the medical profession. Let me introduce them to you. On to my immediate left, we have Dr. Mahesh Rajasurya, consultant psychiatrist at the Colombo National Hospital. Good evening and welcome. Good evening. We are also joined by Dr. Deepa Gamage, consultant epidemiologist at the Epidemiology Unit, Ministry of Health. Good evening and welcome. We are also joined by Dr. B.J.C. Pereira, specialist consultant pediatrician. Good evening and welcome. Good evening. And finally, Professor Indika Karuna Tilaka, who's the president of the Sri Lanka Medical Association. Welcome to you, Professor. Thank you for being on our show. To start off this evening's discussion, I'd like to start with a very simple question to you, Dr. Deepa. What is the current situation as it stands? We are aware that there's a lot of fear-mongering in society, a lot of disinformation, misinformation that is circulating, resulting in a lot of a sense of fear psychosis among the general public. So could you, from the Ministry of Health, clarify and elucidate to us what is the current situation as it stands? When can we expect the lifting of quarantine curfew in the Western Province? We've been told that it has been extended for another 7 days. Are we at the risk of having these quarantine curfews in other provinces as well? Over to you.
Yes, thank you, Sonali. If we talk about the current situation, I will start from the total number as we see today. So total number is 11,224. Out of that, the current cluster, the Minuangoda and the fish market and related, they are service related and the house related, the total number as of today is around 7,600, little more than that. So as you asked about the fear, people should not get fear. It is not a fact to get scared or fear for that, but they should have a very good responsibility to respond to this by adhering to health guidelines and the health informations we are giving. So at the moment, if we look at the global situation also, earlier it was gradually increasing, then it was little flattening, the daily numbers reported, then again it is increasing at the moment. So we don't know the exact reason why these numbers are increasing globally. But our country also we are seeing the similar pattern of increasing numbers. But we have an exact reason of why these clusters have occurred, and it is the numbers are increasing because the country has opened and somehow this one person has come to this 1 or 2 clusters appeared, and then they are, because the country is open at this time and because of the lot of social interactions, lot of people have moved to different districts, and that is why we are seeing lot of cases in different districts. But as of today, the lot of other districts now all are under control. So lot of the people traveled here and there. They have our public health staff and other supportive staff. They have identified. They are quarantined. They are under investigations. So there are times to as it comes, they are undergoing testing and identifying cases. But our main issue is Colombo and Gampaha. Right. We are seeing a lot of cases in Colombo and Gampaha. Based on these two clusters, based on the fish market cluster, lot of people are living in Colombo Municipal Council area. And there are other food supply chain people have gone to other districts also. And now most of people have identified and their family members have identified and already quarantined. And the cases have been identified and they are in healthcare centers at the moment. But I think even though we think that it is somewhat under control, there is a possibility of the transmission from already leaked chains of transmission. Right. So because of that, we have our country people should have a very high responsibility in prevention of the transmission. Their responsibility, their behaviors, they are adhering to health advices and following these advices and adhering to these advices. It is very important for prevention of the transmission from person to person. If we adhere to those things and the health also actively identifying as we are doing it today, identifying cases, remove them from the community and following up all the exposed people at family level and quarantine level, then I think we can control this cluster in future.
Thank you, Dr. Deepa Gamage, for your insights. I'd like to pose my next question to Professor Indika Karunathilaka, President, Sri Lanka Medical Association. And Dr. Gamage, I'd also like to hear your thoughts on this. Currently, there is a multi-sectoral approach when dealing with this pandemic situation. There is great military involvement as well as involvement from the health sector. Can you take us through the nexus and the coordination between relations when we take the military on the one hand and the health sector professionals on the other, Professor?
Yes, I think as you very correctly mentioned, this is essentially multi-sectoral because this is not a section or it's not a situation where only one sector can take the complete responsibility and control. Therefore, it's essentially multi-sectoral. However, having said that, we should not forget this is an epidemic. Therefore, we strongly believe that an epidemic has to be controlled based on the health principles and the epidemiological principles. Therefore, ideally, the guidance and leadership should be coming from the health sector. Having said that, all other sectors play a very important role. Especially we know the security forces and the military, they have played a very, very important role related to contact tracing and also maintaining the quarantine camps. Both are very important. So, I think there are 3 C's that we are talking about: coordination, collaboration and cooperation. And if I may add, communication also. Coordination is the most important thing, and if we are to control the current crisis situation, I think Sri Lanka has the capacity to control this situation. Coordination between those different sectors are very important, and identification of the roles of different sectors. As we have mentioned previously, ideally under the leadership of the health sector, the decision making, for example, whom to quarantine and the decisions related to the case definitions, management and decisions related to different ways of isolation, all these technical expertise and the guidance ideally should be coming from the health sector, but all are important. I think we can think about the government sector, the government, and also the general public and the health sector. All are important. If we talk about the government, again we can think about 3 L's: the legal enforcement, leadership and legislation. And if you are thinking about the general public, we can talk about 3 C's. That is covering basically means mouth and nose, and cleanliness, mainly the hand washing, and avoiding crowded places. And the health sector, 3 T's: that is tracing, very important, and testing and treating. All these sectors come together with the cooperation collaboration. So it's essentially a collaborative approach under the health sector.
Fantastic. Dr. Gamage, what Professor just mentioned, does that work in practical scenarios?
Yes. If I start as the public health system in the country, if we go to the ground level, so we have the MOH system. I think everybody knows who is MOH, Medical Officer of Health. We have the MOH units. The whole country is divided into MOH units. So public health inspector and the public health midwife are the people who are providing the ground level services to the community. So every household, I think Sri Lanka is the only country who is having, every household belongs to one of the PHI or the public health inspector or the public health midwife. So they are responsible for that. In this MOH unit, there are other people, other sectors coming together to provide the community services. Hospitals, we are catering for treating patients, but this MOH unit treating the community. So this MOH unit, the public health system, we don't see how they treat, but they treat for children by giving the vaccination. They treat the population by controlling outbreaks and communicable disease control and prevention. So all these things, public health staff working together with the other stakeholders, local government, police, so they are all working together at this community level. I think in this time, this is a pandemic prone disease. So when it comes to our country, what has happened actually, it is at the top level, they took the decision to make a task force, including all stakeholders. So through that, identified different strategies, but the health strategies, but that implementation side, how to get involved in other stakeholders. So that is what has happened actually.
Okay, perfect. Dr. Mahesh Rajasurya, we recently heard of the tragic suicide of a young man, reportedly due to separation from his mother who had tested positive for COVID-19. What I'd like to ask you is, do you think there's a problem with the manner in which authorities are approaching containment? Do you feel that a militaristic approach is contributing to the panic and stigma? And I'd like to make a case for empathy. How practical is that?
Not very practical. It's difficult. It's always tough, right? These are transitional times. There's no script to run.
Right.
We are learning new things every day, and the decision that we make today, tomorrow may be invalid. So it's tough, and the health staff is overstretched. We have a lot of things to do. Many of the PHIs, many of the MOHs haven't had a proper sleep for a long period of time. So this is tough. So we have to understand that. And the other factor operating here is that, unfortunately, the circumstances have conspired in a way to bring in a status where the treatment of the illness is more feared by people than the illness itself. At least some people, right? That is, you have to get a PCR test, and then if it is positive or not, then you are wondering whether it's positive or not. You are anxious, and then if positive, you are taken away. I mean, these things have to be done. You can't invite people to be at home, don't go anywhere, and expect them to adhere to the rules. We have seen that many instances where people have not done that. So there has to be some sort of enforcement of quarantine or isolation. We have to accept that. It's not nice, but we have to accept that. And that brings in a lot of inconvenience and fear, anxiety, uncertainty into the minds of the people. And this is unfortunately further amplified by certain acts of media and rumors, social media. The wrong side of it is amplified, and people are more afraid than they should be, or people are more anxious than they should be. So this feeds into what I have heard so far. If we talk about this particular suicide, The preventive healthcare staff, the PHIs have tried to find a way to care for this young man, talk to the family, and perhaps somehow they could not mobilize enough social resources to help this man. There may be shortfalls. I mean, we cannot come in without knowing all the information, but the fear of what if I get not the COVID into the list of COVID suspect, that perhaps played a role, but that's not justifying the the inaction of other neighbors or family.
Yes, because doctor, a few months ago we kept on using the word unprecedented. We kept on saying that this pandemic is unprecedented because nobody knew how to respond and react. But I think by now everyone has a bit of an idea. So we can't really be making excuses when it comes to dealing with certain vulnerable people, right? There has to be a set of either best practices. We have ratified the Disabilities Convention, the UN Convention on the Rights of Persons with Disabilities. Sri Lanka signed it in 2007, ratified it in 2015. So we have guidelines, international best practices, which we need to then use.
Guidelines, Sonalia, guidelines. In the real world, we have to act. I mean, they had, it's not that I'm covering up for what has not happened.
Sure.
I do not know what exactly transpired there until I get the full information. So we have to be very neutral here until know exactly what has happened. We have to appreciate that it's not easy.
Absolutely. I can appreciate that, but we need to draw a line between arbitrary action and empathetic action, should we not?
That was not arbitrary action. That has happened to, that needed to happen.
I'm not talking about an individual event, but I mean, this will also happen in the future. There will be more vulnerable people who will be affected by this virus. So do you not think that we need to be more empathetic whilst definitely following the protocols rather than acting arbitrarily? That is my question.
Definitely. Empathy is not only towards one particular person, Sonali. I think what Dr. Deepa was trying to highlight was that, the curative doctors treat a single person and they get the credit. The preventive people treat an entire nation. I think the preventive people need to have more empathy. I mean, they have to think of people they have never ever seen, of saving them from polio or COVID or whatever. So they have a bigger job of saving thousands of or millions. So in that case, treating COVID patients and isolating them from the community is a necessity. That's according to protocol. I don't think the protocol was violated, but it's our job. Again, the health sectors, the other sectors, the social services, as well as the neighbors and the public, to chip in and do whatever we can with our empathy, with our sympathy, with our solidarity. So we are all in this together rather than pointing fingers at others.
Absolutely. Thank you very much, Doctor. Finally, I'd like to move my attention to Dr. B. Seji Pereira, Specialist Consultant Pediatrician. We are told that children are our future. Right now, schools are closed in Sri Lanka, and we've been told that children are known to be carriers of this virus. Doctor, please correct me if I'm wrong. My question to you is, are we in a situation where we can send our children back to school?
Thank you very much. I think it's just about the right time to talk about this, because if you would have observed what has happened about the accounts of the disease over the last few months, many people have been talking about the adults, the economic impact, the social impact, the psychiatric impact, everything. But not very much attention, I must say, has been sort of paid to the case of children. When you look at, as you correctly said, children are the backbone of a nation, and the development depends on children. You and I would not matter very much for the future, at least me. But children, I think, would matter a great deal. When you talk of the careers, I think it might be useful to first look at the general picture of COVID-19 in children. Let's get one thing straight. Children are as prone as adults to get the disease, but for a variety of different reasons. The numbers are much smaller than in what you get in adults. Over the world, all over the world, it's generally about, the detected cases are about or less than 10% of the total numbers. In our case, it's very much less. And Deepa told me sort of a little while earlier that the total number that we have of children who have turned out to be positive was less than 100. So if you are talking of 11,000 positives, total positives, now that's very much less than even 10%. But having said that, a large majority of children who are positive do not have any symptoms.
Right.
So they can also be a source of spreading of the virus. So I wouldn't really call them carriers as such, because carriers in medical jargon has a very definite definition. These are people or children who have turned out to be positive. They true enough carry the virus, but they can disseminate it. Now, some children are much more prone than others to develop problems and complications. That is, like in adults, those who have other diseases, they have a large number of diseases, including respiratory disorders, and children, particularly those who are under 1 year of age, and certainly those who are under 3 months of age, they are a lot more prone to develop complications. Now, in Europe and the America, they have described, I don't know whether you have been familiar with this, a thing in children related what they call temporally, not temporarily but temporally, that is time wise, that both seem to occur at the same time. A much more serious complication, what is called the multi-system inflammatory syndrome, or MIS-C. This has caused a lot of problems. There have been a few deaths as well in France, in the UK, in Belgium, and mostly in the United States as well. Few deaths, not very many. But then most people were under the impression that children actually, a lot of people thought that children actually don't die of it. But in these countries, this has happened. Right. Not very many, but it's a major problem, because in those children who have this complication, many of their organ systems sort of pack up, and it's very, very difficult to treat. Now, having said all this about the general aspect, now you did ask me about schooling. Now, this is a very, very important thing that I think we should come to grips with. Now, children are really not the face of the pandemic. As I said, much less numbers, although they do tend to spread, but still they are not really the face of the pandemic. The face of the pandemic are the adults. But the children could be amongst the biggest victims of this disease, both directly as well as much more significantly indirectly. And some of these effects could be lifelong. But one important thing, if you look at the world scenario, is that nowhere has it been reported that a school has been a center of an epidemic or a cluster. It has not been reported anywhere, and certainly has not been reported in this country as well. And also, what I mentioned about this major complication that you get in the other countries, especially in Europe, we have not seen a single one of those in Sri Lanka.
Right.
So there are so many different aspects to the pediatric occurrence of this disease here. Now, children in many countries have suffered due to this disease, due to what they call multi-dimensional poverty, and that's mainly because they have not had access to health care, because in many countries, especially in the developed world, they have to pay for it. Now we don't have that problem. We have the medical services, the pediatric services, which are thought to be at least some of the best ones in the region. Now when you talk of the schooling, now this is the major problem, because education is the future for children. Now already, now we first said that children are the future of a nation. Now education is the future of children. So if you disrupt education, or for some reason, that this is going to have tremendous long-term effects. Now I am in this position now because of the free health service of this country. Primary, secondary, tertiary, undergraduate, postgraduate education that I have had, I have been the luckiest in the world, because it has been financed by the people of this country. So we have, for these children, right, I said the free health service takes off a lot of the negatives. Free education is the other component of it. Now we are having problems because of the disruption of the free education. So how we are going to deal with this, I don't really know. But when you get children in a classroom, there are certain things that you have to look at. Now, what type of classroom is it? Is it an enclosed space? Is there good ventilation? Can you employ this distancing, social distancing or physical distancing? Can you get them to wear the masks? Right? One thing, children are pretty good at this. They will do, if they are told to wear the mask, they will generally do. They are, forgive me for saying this, they are a lot better than adults. So there are things that will have to be balanced if you are going to open the schools. It's not only what happens within the school. You see, once you open the schools, you have to think of the transport. You have to think of the accompanying persons. You have to think of a lot of other things which may be detrimental to the health of these children.
All right. Thank you very much, Doctor, for your thoughts and perspectives. I'd like to open the floor for questions from our panel of journalists. We have Naveem Majid joining us. We also have Charlene Benedict and Deshan Gonavalu. Naveem, let's start off with you.
Thank you, Sonali. Dr. Gamage, there was, with the curfew announcement, the quarantine curfew, it was initially said to be lifted today, actually. And it's now been extended till next Monday, the 9th of November. Can we confidently say that curfew will be lifted on the 9th of November?
I think it's a very tough question, because we can't tell anything exactly what will happen, how this virus will behave in the community. But we have to think about the people's needs also. So considering that, I hope the government will consider the country transmission situation and then probably lift the curfew. But it is, I think everybody should understand this. What is this lockdown and the curfew? So why this curfew is? Curfew is to control the population movements and to prevent the transmission from one person to the other. But in a lockdown situation, but some countries, as they define, they will provide services. They will provide services within a limited, they limit the travels in borders, and within that locality they provide services. So people are not in a difficult situation. But I think this time also some kind of relief has been given for service providers. Under special circumstances they are allowed.
Dr. Gamake, again with I feel like the communications here is quite poor, because if you take a comparative example, I mean, of course you have to take into consideration the fact that it's a much wealthier country, but if you take the state of Victoria in Australia, city of Melbourne, when you see the communications that are coming out on the part of, because they had a second wave of cases as well after they lifted lockdown, they had to go back into lockdown, and they have very specific instructions, very specific guidelines, which kind of services are allowed, what you can do, how many people can visit a house, how many, like which households, very detailed, very specific, and it has been efficient. The results are there to be seen. In our case, I feel that that level of specificity is missing. Why is that?
I think this guidelines and how to behave and what to do, how and what is there already in guidelines. What is lacking here in our country is how to implement this and how to get people to adhere to these guidelines. And the way the guidelines are given to people in a very practical way on how to adhere this. I think that is what is lacking in our country. But in the health ministry, inside the health ministry as well as in the society also, there are a lot of communication pathways are there. I think our health promotion bureau as well as the some other our professional bodies are also there for community, I mean for the community medicine as well as for the medical association. So lot of communication channels are there, but I think it is the matter of getting together and giving the same message to the people in a way that they can absorb for their practical way to adhere to their daily living. I think that is little lacking in the country. We should accept that. That area has to be improved.
Yeah, because I mean another example.
But guidelines are available.
Yeah.
Lot of guidelines have been developed. It is available on websites, in the ministry websites. Okay. And for each and every social activities, those guidelines are there.
Dr. Mahesh, in reference to actually what Sonali was talking about earlier, we know that doctors, we actually raised this issue on the show a few weeks ago as well. We know that doctors receive training in bedside manner, so on and so forth, how to deal with patients, even if it is at a community level, you know, public health. Do you feel that there is a mismatch in our approach to this, that the idea of this containment effort being driven by the military and by security forces instead of health authorities is actually contributing to a sense of fear, panic and stigma among the public?
Well, I think I would be very...
Just to be, I'm not trying to find fault with the efforts of the military. I mean, they're doing a very good job with the resources that they have, and they are to be commended for it. What I'm trying to understand is, why are we, because this is, as Professor Indika mentioned, it's a health issue, a public health issue, and it should be dealt with. Each stakeholder has their role to play, but the leadership for this should come from the health sector. So my question is whether, since that leadership, at least in the public mind, in public perception, appears to be coming from the military and not the health sector, and that this may be contributing to fear, panic and stigma.
Yeah, what I was trying to say is that, you know, perhaps in future it would be easier to answer your question, right? Right now we are in the thick of it. We don't know what would transpire tomorrow. I think in many countries the military is involved in carrying out the strategies, or the actions. As correctly mentioned, health sector can give the guidance, can decide what to be, how to be done. But what to be done is not entirely a health matter. Now, for an example, the US approach is that people die, we can't help, we will go on like this. But in our country, we want to contain it as much as possible and not let people die. That decision is not necessarily a health or a science decision. You can't say that US doesn't know science or health. They have made a decision, no, this is the way we are going to do it. A certain proportion of population will die. We accept that. But we have made a decision, no, that's not the way it's going to happen. Then, if that is going to be converted into action, then there has to be a lot of, action and enforcement, which is not nice, which is definitely not nice. So it's tough, it's difficult. But having said that, it should not be used as an excuse to be inactive when you need to be active, to be ignorant when you need to be empathetic, to do the easy thing when you know what you have to do is this, right? It should not be used as an excuse at all, but it's tough.
Dr. Pereira, I'd actually like to get your thoughts in on this as well, because we are talking about specifics. I cited the example of some of the steps that they'd taken in the state of Victoria, that the state government there had taken in Melbourne, and things around regulations, like even during lockdown they had or during their curfew periods, they had allowances for like children using playgrounds and park areas. So what I mean by that level of specificity, don't you feel that this is something that even now, like the ability to take children, because an open air space like a park or a playground, that there could be specially designated areas where parents can take their children? Because being cooped up in the house is also not plays with the mind.
Very definitely, I couldn't agree with you more, because I think we need to think of ways in which we'll have to provide the necessary facilities for children to be children. Of course, things have changed from the time that I was a child, because I don't think the children of today have the same kind of life that I had. But one important thing, as you quite rightly said, is not being cooped up at home. So, and there is very little evidence that this can actually spread in open spaces, provided you stick to the basic health requirements. See, keeping the physical distance, wearing masks wherever it is necessary, and washing of hands, all this kind of thing, I think that would be very useful. So I quite agree with you that this cannot go on forever, and hopefully I don't think it will go on forever. But even at the time, the short time that it will be in effect, that we will have to think of ways of keeping these children occupied. I've always believed that the place for children is home, but that doesn't mean that they have to be cooped up at home. That certainly the place for children is not a hospital. And having said that, this is one of the problems that I didn't really have time to talk about this, that currently all positive children are admitted to hospital. And if children have mothers who are positive, where the children need to be, say, very small babies and people like that, that they are also admitted with the mother. And if the children who are positive, who are asymptomatic totally, are admitted, the mother has to be there, because there has to be a bystander usually. That is the usual thing in all pediatric circles all over the world. So there are added problems of having children being admitted to hospital. In fact, the Sri Lanka College of Pediatricians made a plea to the authorities just last week on thinking about ways of keeping these children away from the hospital because they are totally asymptomatic. And as far as we know from all studies, that they may remain infective, vast majority of them, not all, but vast majority of them will remain infective for about 10 to 14 days maximum.
Dr. Kamake, just to clarify, if I'm not mistaken, I think a decision was made maybe last week or so that patients who test positive for coronavirus but are asymptomatic will not be admitted to hospital. They'll be isolated at their residence. Is that correct?
Not at their houses actually.
The quarantine center.
So it is not quarantine centers. Quarantine means those who
you're
have
waiting to see
exposed to a risk factor, they are kept at one place.
Okay.
Quarantine means separated and observed and identify whether they develop disease. That is quarantine. These centers are identified at intermediate treatment centers actually.
Okay.
The doctors, the medical care is provided as given for hospitals and for patients. So they are considered as patients and given the medical care is provided and they are looked after, and if they develop any of the signs and symptoms, they are taken to specialized hospitals. So that is how they are looked after.
Sorry, Charlie.
If I could just pose a question to Professor Karunatilaka. Recently we saw certain incidents, we also reported on these, where people who came down from overseas or people who have been quarantined, they get tested, the PCR test gets done, but it takes a little bit of time for the reports to come in. There were also incidents where samples were misplaced, there was a bit of commotion there, but all in all, during this interim period, people are a bit anxious. And also there was, when the Brandix cluster was first identified, there was a case of the police not being able to find about 119 people for a certain period of time. And as far as the guidelines go on that matter, I'm not sure. We haven't been receiving too much on whether they will be self-quarantined during that time period, the interim period between getting tested and getting the report. Is there any way of reducing this time span? Could it be done better?
Yeah, it's a very challenging question. First, let me explain the situation. About few months ago, now the gold standard for diagnosis of this disease is RT-PCR. That is basically a molecular test to identify the viral RNA. That's a gold standard, and that can diagnose the disease with high level of specificity. So that's a gold standard. Having said that, now few months ago, the number of RT-PCR tests done in this country, not few months, say about 3 or 4 weeks ago, was around 2,000. Around 2,000. That's based on the country's capacity. With the current situation, with so many patients coming in, so many cases reporting, within last 3 weeks or so, from 2,000, it has jumped up to almost 11,000. So that's a huge rise. What we have to think is, this is where the concept of rational testing comes into play. That's very important. We can't be testing for the sake of testing. Just to explain what I am trying to say, I'll give one very important statistics, what we call the test positivity ratio. What is meant by that is, when you do 100 tests, how many will get positive? Believe me, 3 months ago, say 4 weeks ago, before this large cluster came in, if you do 100 tests or 1,000 tests, only one would become positive. If you do 1,000 tests, only one would become positive. That means test positivity ratio of 0.1. Now it has become, you might think 50%, 60%. No. Now the current test positivity ratio with hundreds of patients reporting is that for 100 tests you do, only 6 becomes positive. That's the current situation. So what does this say? That if you are to use this very expensive test, RT-PCR is a very complex, expensive test, it takes a lot of time. You have to do rational testing, targeted testing, as opposed to simple random sampling or just mass scale sampling. If you do mass scale sampling, what will happen is you might do thousands of tests, but the yield that you are getting in the current test positivity ratio is going to be very small. Say if you do say 100,000 tests, you might get about 600 positive coming in from that.
So Dr. My other question is, what should the people really do during this interim now? If you are a
very
person...
Very important. That's what I was trying to come in. That's why I was trying to say, when you are testing, it has to be very rational. It has to be based on criteria decided by the health person, rather than mass carpet screening based on criteria and target. If you do that, then you can keep up the number of tests that would be adaptable to the country's capacity. Because even if you do say 100,000 nasal swabs, there is a capacity in the country that can test these numbers. So if you can do it in a rational way, targeted way, then the time taken to get these results would be minimized. But when there are so many nasal swabs taken because of the pressure for mass screening, then automatically, obviously, there would be a backlog because the country can't cope up. Imagine within 3 months, it has risen from 2,000 to 11,000. I mean, you have to be really surprised. I mean, you have to really praise the system and the Ministry of Health and the laboratory system for ramping up the capacity that much. It's a huge achievement. I don't think many countries can do that.
So, just to interrupt, there's a very interesting, there's a very interesting message circulating, particularly in social media, that from March we've not had any ventilators, we've not worked on capacity for ICU beds, and that we were ill prepared for this second wave. Do you agree with that sentiment, that we were ill prepared, or do you think that the authorities did what they needed to do to prepare for a second wave?
Yeah, again, I think the most important thing is preventing into a situation where we would be requiring hundreds of ICUs. No country can do that. No country in this world can do that. I mean, if you take the current situation, Sri Lanka's number of ICU beds that could be mobilized at the moment, maybe just over 100 at the moment.
130 something.
130 something. That's, I mean, potential to be mobilized. If you take the actual number, it could be even less. However, having said that, what we should be doing is preventing the country coming into a situation where we will be needing 100 ICUs. Because to need 100 ICUs, you need thousands and thousands of patients. So what we should be doing is actually controlling that by breaking the chain of transmission. That's a very good decision that was taken, that the asymptomatics to be managed in institutions but not in hospitals. In that way, actually, you can monitor a very large number of positives, and if they get bad, they can be transferred to a maybe tertiary care hospital. In that way, it becomes practical. So within a very short time, Ministry has managed to identify very large centers, like maybe youth centers and so on and so forth, and convert them into places where you can keep them and manage. So what is required at the moment is to bring this situation under control as soon as possible in different means, by mobilizing, restriction of mobilization, other measures. You have to break the chain of transmission. When the patients are coming in hundreds, you have to manage them and make sure that they don't get bad. So that is very, very important.
Dr. Kamage, I want to ask you this because Professor Karunathilaka mentioned about ICU beds and about preventive steps to be taken. What would you say is the current occupancy of ICU beds by COVID patients of capacity as a percentage? Do you have that information?
Exact numbers I can't tell now, but
as a rough percentage?
Around roughly about 8 or 10 patients are at the moment.
Out of the close to 5,000 cluster that has arisen recently.
Yeah.
Dr. Gamage, a bit of a follow-on question to the preparedness issue. Well, we had this from March, the virus. We had the first outbreak then. We managed it quite well. Since you are sitting also on the task force that is managing the COVID-19, prevention of the COVID-19 pandemic in Sri Lanka, I'd like to ask you, this time around, during the second outbreak, what are we doing differently than what we did in the first time? What have we learned in the middle? Are we doing anything differently? The people should know.
Yeah.
Since you are privy to the conversations.
I will answer to your question. Before that, I want to give another comment for the question you have raised to him. You said that 119 patients could not be found.
No. That was initially. It was reported that 119 patients could not have been found for a couple of days, and then they were located afterwards.
I will tell that all patients were in hospitals, not in the community.
Not patients. These people, they were from the Brandix cluster who were tested, and then in the interim, until the test results came in, they were allowed to roam about, I believe, and then once the test results came in, there was a bit of a hardship in finding these people or locating these people because some of the addresses were wrong, so on and so forth.
Yeah, that company has given correct addresses, temporary addresses, and their permanent addresses. All public health staff in different districts, they found them and quarantined.
Okay, so moving on to the question of preparedness.
Yes.
What are we doing differently this time?
This time we have to respond to this outbreak while the country is open.
Okay.
Earlier clusters, it was very easy because two major clusters we have seen one is the Navy cluster,
Kandakadu,
and the second one is the Kandakadu. Even though we have had some from the Navy cluster, what we have seen, a lot of people have gone home, but different districts, all public health staff responded immediately and identified those families were quarantined and cases have been identified, and then transmission was not there, and they also recalled and then could control the outbreak because it is in an institution. And the Kandakadu also the same. There were some service providers from outside, but we could identify them and quarantine the families and the contacts, and some people were taken to some centers, and then that they all were in one institution. But here the country has opened, and at that time the country was, most of the places were I would say closed because the curfew was there throughout the country. Because we all are, listen, it was a new thing to us. Then after that, all the changes have been done in the country to face this kind of outbreaks while the country is functioning. That is how the new normalcy came. But the issue is, at the very beginning when the country is open, all of them have adhered to, all the companies, the people in the country, and those who wanted to have some functions, they all adhere to these guidelines or the recommendations given. But later on, they got some confidence because people are coming through the ports of entries, means from the airports and the seaports. They were separately quarantined, and the cases appeared only from them and not from the community. Because of that, because of that, people developed some confidence and they deviated from these health guidelines, I think. These recommendations have not followed properly.
Right.
That is why now we are responding to this outbreak while the country is opening. And people are functioning in a routine way.
My final question I'd like to pose to Dr. Mahesh. Dr. Mahesh, you said that implementing these measures are hard. We're living in tough times, so sometimes, issues like mental health may have to take a back seat. And while there is an argument for that, mental health has always been played down in Sri Lanka. It's sometimes not even considered as a real health issue, mental health, to the public at least. So in these times of stress, where people are cooped up at home, they might be facing issues in finding money to feed their families, to feed themselves. What is your advice to people who are indoors right now, when they do feel this stress really kicking in and they lose hope? What can the people do to respond?
I never said that mental health can take a backseat. No, never. Mental health can never take a backseat because the people who are doing this need to have good mental health, otherwise they are not going to do a good job. The public need to be in good spirits to get through this, right? We can't terrorize the public, make them feel down and out. Mental health is not just having a psychiatric illness, right? Being happy, being content, being hopeful, being connected with other people, all these things are part of mental health. So it's very important. Mental health is very important. However, these kinds of times do affect our mental state. There's no question about that. Mainly because of the uncertainty, will I get it? Will my family get it? If I get it, will I die? And death anxiety, am I ready to die and all that? But on top of that, as I said previously, you know, these are tough times, so tough measures are taken. So we are all afraid, more than sometimes getting the infection, of rather than that, going through the, you know, the next steps, you know, being tested and being taken away, or having to spend prolonged periods in hospitals, being cut off family and not knowing what's happening. So that is tough.
Doctor, is there enough support provided for mental health issues? Are there helplines that people can contact? Are there certain things that people can do in their house to reduce the amount of stress? Any advice?
Yes, we should not look at mental health issues as illnesses where doctors should treat. The mental health issues that I just mentioned are issues that are present and relevant to all of us. So then we need at least 1 million doctors or therapists to treat this. It is not practical. We have to help each other. We have to help each other. The media has to come in this and instill hope and content and good spirits in people rather than fear and anxiety.
Thank you very much. With that, we go in for a short commercial break. We're delving into the implications surrounding the ubiquitous COVID-19. We'll be right back. What does the future look like for Sri Lanka in the face of COVID-19? Should it not be a future that's acceptable to all the peoples of the Republic? Welcome back. This is Face the Nation. My question in this round is to Dr. Deepa Gamage, Consultant Epidemiologist, Epidemiology Unit, Ministry of Health. Dr. Gamage, this is technically a policy issue, but I thought it would be fitting to ask you this, if I could perhaps get your feedback on this. Sri Lanka is aware that health officials and military officials, essential workers, are working tirelessly around the clock to curb the spread of this virus. However, there are certain concerns that people, the general public, raise. This particular issue has been particularly flagged by former MP Ali Zahir Maulana, who raises a question regarding the cremation of remains of Muslim victims of COVID-19. He says that they seek a dignified burial in keeping with international norms, guidelines and regulations practiced worldwide. And they seek an intervention on reversing COVID-19 regulations on cremation of deceased victims. Now, if I am to understand correctly, the World Health Organization has not prohibited victims of COVID-19 from being cremated, right? Could you tell us, perhaps from your point of view, from the Health Ministry, the reasoning behind this policy, please?
Yeah, I think first of all we have to understand that WHO, World Health Organization, is giving general guidelines to the whole world.
Absolutely.
But country-wise, there are, not only for this coronavirus, even for other things also, country-wise, the country decisions are taken based on the country requirements sometimes. Right. This coronavirus started in this last December, and it was a new virus at that time. And it was a pandemic prone virus, identified as a pandemic prone virus, and pandemic has happened actually. So when our country also at the very beginning, this kind of pandemic prone virus, we didn't know that how this virus behave, and still we don't know. The globally also very little evidence is there how this virus behave and how mutations will happen and how can this transmit even from dead bodies and even from human to human, even though we say it is only droplet and this kind, but we don't know in future whether we identify any other methods also. So in this background, at the very beginning, lot of discussions were there in the country, within the country, lot of technical committees formed to discuss separately, and considering the betterment of the country and for the protection of the country while appreciating the cultural values, I think this decision must have been taken based on the protection for the nation.
Right.
So it
erring
is,
on the side of caution.
Yeah, because considering only about the virus and the disease and how to prevent this and protect the people. That is only considered while appreciating cultural values, we know that. So I think it is the country specific decision has been taken.
Thank you very much for your feedback, Doctor. Professor Indika, would you also like to contribute to that response?
I also agree with what Dr. Deepa said. I mean, we need to understand the sentiments of all the cultural or the religious group, which is very much correct. But in this situation, like Dr. Deepa mentioned, we don't know much about how this virus behaves. Even if someone gets this virus and recovered, we still don't know what are the complications, future complications that person will have. So, I mean, there are some evidence that are related that there may be a possibility of the disease being transmitted from a dead body. There are some cases, and there are some evidence about soil transmission. And so all this actually, like Dr. Deepa mentioned, is a technical decision. Technical decision with minimizing risk, because as a country, Sri Lanka has controlled the situation very well. So in that situation, it's fair enough that you don't want to take any risk at all, whatever is. So it's basically a risk minimization approach based on the current evidence that is available and a technical decision.
Right.
And a technical decision for the welfare for the masses, for the whole country.
At the beginning of the show, we agreed that curbing this virus requires a multi-sectoral, multi-stakeholder approach. Can you tell us as to whether there is a sense of collaboration between Western medicine and indigenous medicine in Sri Lanka currently? Because I'm specifically asking this question because some people tend to take home remedies, drink a bit of kottamalli, and perhaps ignore symptoms. So is this all right? Is this acceptable?
Yeah, the thing is, I'm based on my specialty. I'm not very much aware on this indigenous medicine, what are the ingredients, how it behaves, that kind of things. Actually, I'm not very much aware.
Yes, but is
how
there
these
collaboration
ingredients behave within the country for prevention of this COVID.
Right.
That part actually I don't know. But taking some
home remedies,
harmless liquids and harmless medicines, means some kind of food items or the liquids, will be okay, hopefully. But how these ingredients content included in these food items or the liquids will behave in the body to prevent COVID, actually for me I don't know.
Right. Well, Shalan, would you like to pose your next question?
Yes, of course. Dr. Deepa Gamage, we spoke about what we've learned from the past and what we're doing differently right now. You said at the beginning we were closing down the entire country, everybody was under quarantine, but now we're just opening up sectors. In these meetings that you have of the task force, are matters like distribution of food items and introducing maybe mobile apps, now since we have that technology available in Sri Lanka, were these discussed especially during the past, and are there any blueprints that can be implemented right now?
I think a lot of discussions were there and a lot of people have came out to implement this kind of apps and distribution of medicines and online ordering of some other items, food items and other things. Those things have already discussed, and some part of the country it is implemented also. And the thing is how to do that, and whether in those lockdown areas or the curfew implemented areas are the areas specifically focused on distributing medicines as well as online ordering of pharmaceutical products.
Dr. Pereira, I'd like to ask you, under the current guidelines, of course, people can't leave their homes. There are certain countries that allow people to, go out, take their children out to parks. There are certain relaxed regulations in other countries, but we have taken a strict approach on that matter. No one can leave their homes, everybody, at least in the Gampaha and the Western Province right now. Speaking especially about children, what is your advice to parents on how they should interact with their children during these times? What's the best course of action that a parent can take in relation to their children?
That's going to be a tough one actually, because we have always said that we have advised parents to spend quality time with their children. Now they got quality time 24 hours a day. So they have a problem really, the parents, trying to find ways and means of keeping these children occupied. Of course, screen time, now we advocate certain restrictions on screen time, like computer viewing, the television viewing and things like that.
Mobile phones, games.
Mobile phones, all this kind of thing. Now, what else can we get the children to do? But of course, you will have to think of very novel ways of doing it.
Any suggestions, doctor?
Sorry?
Any suggestions?
Now, the reading habit virtually has gone out of many households. I think this is the time to bring it back. Now, during the time that we were children, reading was the main thing. None of this stuff was there. There were no screens, there were no nothing. So, reading, I think, should be the thing. The other thing is some forms of exercise at home, right? Maybe a little bit of something like healthy competition in the garden, things like that. I think you have to think of very, very novel ways of doing that. It's not going to be easy because you have to really put your mind to it to get the children occupied on this. But to add to this problem, there are now some of the schoolwork that is being done through the web and internet. So now that keeps a lot of the children occupied for hours, sometimes from 8 o'clock in the morning till about say 2 o'clock in the afternoon. So beyond that point, so up to that point, they are
all good,
kept occupied. But then the moment they are practically sort of, so to speak, released from that, we'll have to find ways of keeping them occupied after that. So you have to really think of very novel ways of doing it. And the other thing that I think there has been a lot of advertisements on this, getting them included in gardening, things like that, helping in the sort of standard household chores, all this kind of thing. I think these are very novel things that people will have to think of it. People are not, I think they are pretty good at this. I think they will, if you point this out to them, that keep them occupied, that it will probably work.
Professor Karunatilaka, from the onset of this question, I must say that I don't believe this is too much of an important question. I believe the general public must fulfill their duties in curbing the spread of this virus. But there was a lot of discussion and a lot of criticism going to and fro, asking as to if community spread has begun in Sri Lanka. There were various satirical memes that were drawn in this. So just to clear the water on that, has there been a community spread? What's your take?
Thank you for asking that question, Charles. I think Dr. Deepa is the technically more correct person to answer this question, but I'll answer your question directly. Maybe.
And of course, Dr. Deepa also will get a chance to clarify.
Now, community transmission is essentially a technical term. So there is an unfortunate confusion between patients being found in the community and the community transmission, because community transmission is actually a technical and epidemiological definition which has to be declared by the technical experts. We think patients being found from the community is equal to community transmission. No, it is not so. But this unfortunate similarity between the community, in Sinhala you say Samajen Rogin Hamba Veno, that like that. So that is very similar to the technical word that is used for community transmission. So there is unfortunate confusion. It's a very highly technical definition, and basically the most useful definition comes from WHO, which basically says patients can be found, but when there are patients that cannot be traced to a link or maybe identifiable cluster, then community transmission might be there. But having said that, having few patients getting from the community again is not equate to community transmission. There may be some patients, due to multitude of reasons, you might not be able to trace these patients to a particular link. That's always possible due to the lack of data, so on and so forth in this kind of situations. Getting few patients, according to WHO definition, it says a significant number of patients found from community. But unfortunately, WHO doesn't say
how many.
So that's why I am saying this is a technical definition that has to be declared by the technical experts. Again, you may ask, does it matter? I would say it does matter, because once you declare, it's a serious situation. And for example, once you declared community transmission, there's not much point of doing contact tracing, which is one of the most important tools that the epidemiologists are having. So a lot depends on that serious declaration. I think this situation, what we have to understand is, this is a serious situation which has to be curtailed immediately with immediate measures, and we should be using all our measures and tools like contact tracing, quarantine, isolation, treating. All these measures has to be used to curtail this situation rather than worrying about terms, because this term is an essential term that has to be declared by the experts, and lot of things including the diagnosis, management or the community management, all these will change once you declare a community transmission.
But of course,
thank you very much. Thank you. Dr. Deepa, there's a question coming in from Dr. Yasuni Manikage for you. She asks, when will the ministry commence rapid testing, and what are the pros and cons of it? We have lots of doctors tuning into our program tonight.
Thank you. So at the moment, ministry is planning to get down the rapid test. So we are working on that. Rapid test means the antigen detection test. It is not the antibody. Antibody test is already there. The country is using that for supporting the discharge of some of the patients. So it is already there, but it is not that helpful for early case detection. So because of the PCR, there are two reasons. The limitation of the PCR testing capacity, as well as the time consuming test, and the highly technical expertise are required for that testing. Because of that, now countries decided to change over from that PCR to rapid test only for surveillance purposes. That is not for hospitalized case detection for specific diagnostic things, but for the surveillance purposes at the community and special categories like some institutions and the factories, companies. So in that situation, we will be using probably by next month we will be getting some stocks.
Right, and how effective is it?
The thing is, when the country is having a high transmission or high caseload, then the identification would be much more. When the caseload is going down, we call that the sensitivity, how much we can detect cases. So when the caseload is going down, it is little less, but it is somewhat similar to PCR and little higher than the PCR.
Right, but much faster.
Much faster.
Okay.
And there is another technical term that how we can say that those who are not having as no patients, that is the specificity, that is also very high. So it is a good test, but there are a lot of test types, but country planning to get down the WHO validated test. At the moment, 3 laboratories are doing the country specific validation. Even though the WHO validation is there, country specific validation is ongoing. If it is successful, most probably in 2 weeks time it will be available.
Dr. Gamage, if I can just pose one more question related to the initial question that I posed to Professor Indika. He said that the World Health Organization has classified this term community spread as a significant number of people being identified from the community that cannot be linked to a cluster. Currently, as far as my knowledge goes, we have two clusters, the Minuwangoda cluster and the Paliagoda cluster, currently active in the country. Roughly how many people have been identified from the community that cannot be linked to one of these clusters, or are there more clusters, Doctor?
Very few, I would say. Because Minuwangoda cluster, I would tell the experience of how we have detected the Paliagoda cluster. From the Minuwangoda cluster, we couldn't link 3-4 cases. Then we saw the same link is there for the fish market. That is how we have gone. We have identified doing the small sample. Sample means the small number of people, 150 people from the fish market, and then identified more than 50% affected. Then within 24 hours, then the whole fish market people on that particular day subjected to testing and identified, and then all these actions have been taken. So then after that, we have detected a lot of cases from other areas. From an outsider, they might think that a lot of cases are coming from here and there, but it is not. It is based on the epidemiological linking we have identified, because each and every patient, when we identify, we get a detailed history. At the very beginning, on the very same day, epidemiology unit contact these people and get the full picture. Where they have gone, whether they have gone to any weddings, functions, and whether they have gone anywhere, different districts, we identify and we give the task to district regional epidemiologist and the team to investigate on that. That is how these different area clusters and the people have identified.
Dr. going a little bit back from that, now we knew that Sri Lanka did not have any cases in the community for quite an extended period of time after we successfully controlled the first wave. Where did the Minuwangoda cluster really begin from? Has the Minuwangoda cluster, or the first patient, or the first set of patients that were identified from this cluster been linked to anywhere?
Yes, the thing is, we couldn't identify it exactly. But after doing some epidemiology unit working together with getting the support from the military also for contact tracing sometimes when we have some difficulties. Then we have identified some link through the imported case in one hotel, and some of the service providers have gone out, and we have identified some kind of suspicion was there. So that was from the
suspicion
European,
of foul play.
That is that person is from that main contact is from the European region. So the Russian, actually the Russian person. So Ukrainian. So then we thought that the exact person. So based on that, we thought that is the possible link which has come there. Earlier we thought there is from the airport, one airport hotel also we have suspected. So suspected places were there. Then after that, now we have a very good research study done by the Sri Javardhanapura, headed by Professor Nilika Malavike. So now they have given us the evidence. So
that it was
a European strain,
Europe.
European strain is there. So these all people we have identified from different places are linked to the same strain.
So would I be correct in saying that this second wave was a result of a certain group of people, or someone finding a small slip in the system and trying to creep through that?
Probably. The leaking may be there from some imported case. From the imported case means the...
But is the task force investigating that?
Yes. At the moment it is under investigation.
Right.
Dr. Rajasuri, just one final question. You've seen, if you watch TV, in the US, this whole idea of lockdowns, this whole idea of combating COVID has become a political issue. In the UK, you saw people protesting on the street, against lockdown measures. In Sri Lanka, the western province where we are at the moment, again, we are going for a partial lockdown of sorts for a week now, maybe a bit more, as we learned today. How important is it that people, because jobs are on the line, the economy is on the line, businesses are on the line. In circumstances such as this, how much of a part does it play psychologically on the people, number one? And number two, how important is it that this short-term loss is borne for the medium to long term gain, where they can actually come out of it and return to some form of normalcy, at least like we did enjoy for 3-4 months?
We hope that it will be worth in the end, right? These are all predictions based on technical matters. We can't say for sure, right? There is no right and wrong decision, but decisions have to be made, and only history will tell us whether we made the right decision or not. So, but it's very important for the government, the decision makers, to consider all these aspects, including the economic aspect. And you know, a father not being able to, a mother not being able to feed her family for the next few days, for one meal, for one day, is a very serious matter. The anxiety that those parents are experiencing is enormous, right? We have to appreciate that. We have to know that. We have to be able to resonate with that feeling in making all these decisions. But I'm sure all these are considered and these decisions are made. Of course, you can, you know, argue perhaps that's not the way that we should have thought, it should be another way, and we can always argue, and there's no definite right or wrong answer here. However, I think we need to be aware of the psychology behind these decision making. I mean, when we locked down and announced the curfew, we also need to be able to guess what people might do, and you know how the psychology works. So this has to be taken into account as well, as much as the psychological burden. So if I may answer a couple of questions maybe raised earlier, there are many ways of helping people who are undergoing psychological difficulties, you know, providing practical information. There are numbers to the President's Secretariat and the COVID Task Force general numbers, and then there are mental health helpline number line maintained by National Institute of Mental Health, and there are many organizations. For example, an organization I'm linked with Institute for Psychological Assessment and Treatment. They are running a free mental health helpline. So people are trying to help the public, the people who are undergoing difficulties. I mean, we can't just name them, label them psychological difficulties. Any difficulty, not having food to feed the family, is a psychological issue as much as a hunger issue, as much as a financial issue. So we need to be aware of all these in making these decisions.
Dr. Gamage, if I can pose one more question to you. Now, we know that the entire financial issues that people face, and initially when the COVID-19 clusters were detected at Brandix and other apparel factories in the Gampaha district, there was a circular or a letter sent by the authorities to these companies requesting them to conduct the PCR test on their employees, and a PCR test ranges from 6,500 to higher, depending on the kind of facilities you get at hospitals. Moving forward, does the government plan on providing PCR tests to everyone, or is this private testing really going to be a thing that the people on their part should prepare for if things get worse? Should people start collecting money from now, maybe say in a month or two, if things get worse? I'm hoping for the best, but I'm saying we should be prepared for the worst.
If you think about need to provide the PCR for everybody, then every day 21 million tests to be done for everyone, because even though the interpretation of this PCR testing has to be done very carefully. So if you are undergoing the test today, there is no the assurance that you will not get the disease tomorrow. The virus you are exposing to the virus tomorrow. You can get the virus tomorrow. That is why Professor Indika said that it has to be a well-focused, high-risk strategy for the testing. And even though about the surveillance testing of these companies, so there should be another. If you detect one case by doing the testing in this BUI region and other companies, if you detect a case, there should be the method of doing the testing for others. It should not be you have to identify the close contacts, do the testing, then identify, and then need to decide on what would be the number to test and what would be the time to do the testing. Otherwise, it will be actually the waste of time, waste of money, actually.
Also, Dr. Gamage, is the task force looking at opening up more institutions as we go along, of course, as we continue to get these clusters under control? Is the task force looking at gradually reopening certain other facilities, like, for example, maybe even parks at a time?
You mean the treatment centers?
No. Moving on, facilities as in
facilities means
facilities as in institutions. So for now we have essential services open, certain drive-throughs for food and other things open. But will there be more openings as we go along?
I think yes, true. Yeah, the thing is, all the issues are coming only during this curfew period.
Right.
And the other services, how to provide services to those who are remaining or keeping inside rooms and in quarantine, and how to provide services for them. So these things will be developed in future. So how to provide the doorstep service for them in satisfying their requirements, and the areas when there is a limiting the areas based on the imposing curfew. For those areas also, how to make available the nearest shop for them, rather than opening big for everybody to go and do the shopping in other markets. How to make available the nearest shop for them. Then the movements will be limited. So that kind of strategies will be implemented in the country.
All right. Thank you very much. With that, we're going for our final commercial break. We'll be right back. Stay with us. Welcome back. At the beginning of the show, I mentioned to you the importance of us as the general public, us as the citizenry, to be socially responsible and also aware and cognizant of the protocols, the health regulations, guidelines, the legal guidelines, and the laws that have been put in place in order to curb this pandemic. Now, according to Article 14 of the Constitution of Sri Lanka, every citizen is entitled to, inter alia, among other things, freedom of movement and the freedom to return to Sri Lanka. However, these fundamental rights can be restricted in the interests of, among other things, public safety, protection of health. However, these have to be adhered to in terms of the legality and proportionality. These are two aspects that also have to be considered and weighed in. Now, currently, very quickly, let me elucidate to you the laws governing this area. The Public Security Ordinance, the Police Ordinance, the Quarantine Prevention of Disease Ordinance, and the guidelines issued thereafter by the Minister, as well as the Penal Code. We have almost come to the end of tonight's discussion. So in furtherance of a hopeful future for all the peoples of Sri Lanka, Dr. Deepa, I'd like to ask you, what is the way forward?
I think whatever the guidelines or the law enforcement or the gazettes issued, whatever available in the country, the prevention for this outbreak is to adhere to basic guidelines given.
Right. Do you think that there is a gap between the guidelines themselves and the people?
Yes.
Okay.
The thing is, all the things are there. People know. What you know and what is practiced are different. That is the gap.
Okay.
All
and
the
how
guidelines
do we overcome this?
I think that is the responsibility of the people.
Right.
It is, there can be some supervisory or the monitoring bodies, and there are people to tell. So then what to do? but how to do and how to implement means how to themselves adhere to these things. That is the responsibility of the people. Main part is the responsibility of the people to prevent this outbreak and prevention of themselves. So we can develop lot of guidelines, we can enforce lot of laws, and so it is, if you enforce any law, that is people do things for fear. That also needed for the country for some part. That is why those things are there. But I think if you identify, if you convince yourself on how to prevent this is very simple things we are asking people to do. I think this time we have seen that people are not adhered to any of the things what doctors or the medical staff are asking to do. So most of the things, even limitation of the travels and having limited numbers in the functions, and how to in some kind of functions how and what to do, means not hugging. We asked them not to touch each other even, but they have not adhered to that. When we asked whether you have kept the distance, they say yes. Were you with the mask at that time? They say yes. But after that, in a wedding or some party, after that they all have hugged together. So what is the point then? How can we prevent the virus transmitting from one person to the other? So then all these things are not up to the mark by the people. So then I think it is the responsibility of the people and themselves. It is okay that there are some monitoring bodies, but it is the response. I think to come out of this outbreak, we have to adhere the basic health recommendations. Then we can prevent the transmission from this country, the virus, and then we can save our country people.
Thank you very much.
Can I quickly come in, Sonali?
Yes,
that,
yes,
there's a psychological explanation as well. I partially do agree that people are responsible and they have to do it true. But if they don't do it, we also need to understand why, the psychology behind this. Now, for an example, in most of the developed countries, the pubs are closed, either permanently or at least the opening hours are severely curtailed. And in Sri Lanka, people don't take alcohol a lot in pubs, but they buy alcohol, go to home, bring in friends, a number of friends, no masks, no social distancing, big parties. I mean, even if it's 3-4 people and many households, many households, it's happening. I think it's time to close down the alcohol sale points, the wine shops, the tobacco smoking, a severe risk factor for getting COVID and making it worse. I think we need to understand how these factors operate and then take action. I mean, it's important to tell people, okay, wear masks, don't gather, keep social distancing, but we also need to study the factors, the dynamics behind these not being adhered to, and take necessary action as well.
Yeah, Doctor, I'd like to ask you a very basic question, and this is a question that comes up when we go to villages. People ask, "Ane api ගෙදරින් මොනවද කරන්නේ? What do we do at home?" Because people are so used to working from 9 to 5 or doing day jobs that they have no idea what in the world to do with all this time they now have. And it's a reasonable question, because we don't have a set of guidelines as to what to do then. So how would you, from a psychological point of view, advise?
Well, one thing you need to pay attention to is that some families are doing very well under lockdown, and some families are doing very bad. If I have an hour, I would go into the depths of it and explain it. But in short time, in a short period of time, what I can tell you is that if the family dynamics, if the relationships are already not very positive, if there are issues, they are likely to get worse during the lockdown.
Yeah.
But if you are aware of that, then try to make it a challenge to turn your relationship around. Maybe between the husband and wife, maybe between the mother and daughter, you can make a difference. I mean, That's where you are going to find a solution in. I mean, listing this, you can do this, you can do that, I mean, if you are not in a good mood, you won't do anything. So the love, the solidarity, the team spirit, let's keep an eye on these things and see what is eating into our happiness. And let's try to make things around during this lockdown.
Doctor, in terms of training and development, since this is an evolving issue that we are facing, which needs more and more additions as we go on, could we not perhaps ask of these health professionals who go to people's homes during these times to then advise, in addition to the disease and all of that, something with regard to psychology, basic psychological guidelines? I don't know. I mean, is it practical? Can we also look at that?
You are doing
from
it right
a very
now.
human point of view.
You are doing it right now. You are doing it right now. You are taking these messages to the homes of people, right? So I think media has their work cut out here, right? Giving people hope, widening their horizon, not making the negativity, the anxiety and the negative energy more, looking at actual problems they have. Sometimes families are split and there are actual grievances, the suicide you mentioned. So let's get together, all of us, and help each other. And one day I may help my neighbor and tomorrow the neighbor might help me, right? Just don't think that only the experts can do this. Let's all of us get together and as a nation get through this.
Thank you very much. Dr. B.J.C. Pereira, Specialist Consultant Pediatrician. Doctor, my final question to you is, when we take children, they face their own set of medical issues. In this fight against COVID-19, have we perhaps forgotten some of the key aspects with regard to health concerns when it comes to children?
Yes, really offhand I can think of just a couple of things. One is, of course, that we are very conscious of the fact, the detrimental effects of admitting children who are asymptomatic to hospitals. So I think having some kind of isolation facilities outside hospital under medical supervision, so that if they develop some symptoms, action could be taken for the necessary period of time. The same time that they are spending in hospitals now, I think that should be the way forward for the children who are positive. I think from now onwards, if that can be, this is something that we have advocated from, as I said before, from the Sri Lanka College of Pediatricians. The second one, I think, is the most important now. This is more or less a tribute to the parents of our country. In the initial phase, with the first wave, when there was curfew around, that a very, very important procedure that was implemented, that is the immunization or the vaccination program of the extended program of immunization in the country of the Ministry of Health, tended to get a little bit disrupted. Not much, but a little bit disrupted. But now that has been addressed, because the Ministry of Health, the epidemiology unit, the Family Health Bureau, everybody has taken necessary steps. We have changed the schedules whenever necessary, and this has been caught. And why I say that this is a tribute to the parents is that so far, I think over the last 50 years, that we have brought down the childhood mortality rates, the infant mortality rate, the under 5-year mortality rate to almost the levels of the developed world without having any of the resources that they have. And this is a tribute to the parents. And even in this instance, that when things were disrupted, the first thing they did once some kind of normalcy started, was to bring their children for the immunization. So that, I think, having said that people are not doing this, people are not doing that and all this kind of thing, this is one thing that the way forward would be for these parents to continue with this process of optimal immunization procedures being given to their children.
All right.
Thank you.
Thank you. Thank you very much, Doctor. And last but not least, I move my attention to Professor Indika Karunatilaka, President of the Sri Lanka Medical Association. I have a difficult question and a hopeful question. The difficult question is, it's a tweet by Mr. Iran Vikramaratne. He says, the government employees that carried the weight of our economy during the initial lockdown were villainized and bundled off to quarantine centers with no proper facilities or dignity. Is continued criminalization of COVID-19